Hi, I'm Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council. I was asked to explain a little bit about what is public health and what does Director of Public Health do when I'm not responding to a COVID pandemic. So first of all, what is public health? Public health is described as being a bit of art and a bit of science, and it is a medical specialty, although we do train non-medics in it as well. And the job of public health is to protect and improve the health and well-being of a population. When I trained as a GP, I was training to treat a patient as an individual. So I'd see a patient, I'd take a history, examine them, look at their signs and symptoms, diagnose what was wrong, and then agree a path of treatment with the patient to improve things. Now I'm a doctor in public health. I do the same thing, but I do it for a population rather than individual. So instead of looking at one person at the time, I look at the whole population of Birmingham or a subgroup within the population of Birmingham and do the same thing. Look at the pattern of illness, look at the signs, the symptoms of the population's health, diagnose some of the issues that are going on, and then work with communities and partners to try and implement treatments, interventions that will make a difference. So public health medicine is very much like any other form of medicine, except we deal with looking at lots and lots of people as a population, as our patient, rather than the individual. As a Director of Public Health, I'm appointed by the Council and by the Secretary of State for Health, and my job is to be responsible for the population who live in Birmingham. And many of you will have seen me over the last 2 years in terms of the response to the COVID pandemic. And health protection is an important part of what I do. In normal times, that will be responding to outbreaks of TB or measles or chickenpox, where we're seeing more than we would expect or in a particularly vulnerable population. We do that with the UK Health Security Agency. Another part of my role is around addressing the things that cause ill health. And that's looking at the wider determinants, so the impact of poverty, poor housing, the physical environment we live in, the economic situation of the city on people's health and well-being, as well as how can we improve people's lives through supporting them to be more active every day, to make healthier choices about what they eat, and trying to support them to give up smoking and to avoid addictions like substance misuse or gambling. There's also part of my role, the third pillar of public health, which is around quality improvement and working with the NHS. So there is a part of the work that we do which works closely with our NHS partners around improving pathways of care, looking at inequalities, and also providing expert advice and support around the commissioning of some services and looking at the evidence base, particularly around expensive treatments, to help the NHS make the most effective decision of how it spends its resources. So I was asked about what do I enjoy about my job? Well, I really enjoy being in Birmingham. I moved up to the city when I took this job in 2019. Birmingham is the largest authority in the country, so this is the largest Director of Public Health job in terms of a unitary authority, and that is a real challenge, but it's also really exciting and a lot of fun. Nowhere else do we have enough diversity in our population to try and get into understanding the difference between different African communities in our country. Most areas will just see African people as African people and never have enough of a population to bother scratching the surface and trying to understand, are there differences between our Nigerian community in Birmingham and our Ghanaian community in Birmingham? Similarly, are there differences between our African community and our Caribbean communities? And in Birmingham, we're big enough to be able to explore those questions and to engage with them. And that's really exciting from a public health point of view. Sadly, I think Birmingham has lots of challenges. Life expectancy here is less than it is in other parts of the country. Life expectancy within the city is very different. If you are born into some of our poorest wards, places like Heartlands, you can expect to live about 10 years less than people born into some of our richest parts of the city, like Sutton and Four Oaks. And there are lots of reasons for that, but we need to really unpack that and try and change that, because It's not okay that people in Birmingham, because of where they are born and the lives which they lead shorter lives than other people living in the same city. But that leads me into, I suppose, the answer to the question of what's the most difficult part of my job. Well, the difficult bit is Birmingham is huge. You know, if I was working in a much smaller area, the numbers of people that we're trying to help and support will be much smaller. And that's a real challenge when we're looking at funding interventions. You know, we are about middle of the pack nationally for how much we get to spend on public health per head of population. But the reality here is that the number of people who may need an intervention is bigger. So if you take something like a childhood obesity intervention, some of the best evidence-based interventions cost about £200 to £300 per child. And when you look at the number of children in Birmingham that are carrying excess weight, we're looking at tens of thousands of children. And so very rapidly, this becomes an unaffordable number. So I think one of the challenges in public health in the city is to move away from trying to patch people up and instead trying to prevent the issue occurring in the first place. And that's why a lot of the work that we're doing in public health is about trying to get upstream of the issues and focus on changing the environment of the city that we live in, making it easier, more affordable and more accessible for people to access the right healthier choices and to access support when they need it. But ultimately what we're trying to do is reduce the number of people who need support, because otherwise the approach is not sustainable. The biggest challenges in public health for Birmingham, well, there are lots. If we look at the life expectancy gap and why people are dying younger here than other areas, within the city, between the city and the rest of the country, a lot of that is driven by infant mortality. And we need to reduce the number of babies that die before their first birthday. And that means having conversations about smoking in pregnancy, about obesity, about working with parents to plan pregnancy so that they are in the best possible place they can be to give their baby the best start in life. And that's quite a challenge, but it's been something that's been an issue for the city for a long time, and we need to change that. I think there are challenges about how we support people to live healthier lives and make it easier. Lots of us at the moment are really feeling the cost of living impact on our wallets. And so it's all very well to talk about a healthy diet, but if we're not changing the environment of the city to make food affordable and accessible, then we're setting people up to fail. And it's really important we think about the environment of the city while supporting people to make healthier choices. And it's great to see some of the improvement we've done in terms of infrastructure for cycling and walking, for public transport. We know that most people get physical activity through the everyday trips, not through going to the gym. Gym is great, but it's unlikely to be the way that most of us get physically active in a way that improves our health. So there's some of the things that we are working on, because inactivity and diet are very definitely driving some of the big burdens of disease in our city, like diabetes, stroke, heart attacks and cancer. And the third one that I would mention, because I think it is important we don't forget it, is smoking. Smoking still contributes to a significant burden of deaths in Birmingham. And although rates of smoking in young people are going down, which is good, they remain too high in too many communities. And we still need to do more, I think, to address tobacco consumption, whether that's in cigarettes or shisha pipes, or smoking joints. We need to do more to help people to find different ways to get pleasure and relief and relaxation, because the tobacco is frankly killing them, and too many people are dying because of tobacco in the city. So what's my ambition in the role? Well, there are lots of things I want to do, want to achieve. I'm delighted to be joined by Councillor Khan, taking over from Paulette Hamilton in the cabinet role in the council. I'm really lucky in Birmingham to have very strong support from elected members. on both on all political parties, and also from local MPs. And I'm sure as Paula takes her role in the House of Parliament, she will continue to have a particular interest in public health and push us forward. I'm also really blessed that the leader is very committed to this agenda as well. So my ambition is to work with the council, with the partnership of the city, to leave the city better than when I came. And ultimately, what does that look like? Well, it looks like a city in which it is easier, affordable, simpler and funner to lead a healthier life than it is to lead an unhealthy life. And that's quite a big ambition, but I think there are some really exciting things that have already started to happen in the last couple of years. I think the partnerships we built through the response to the COVID pandemic put us in a really good position moving forward. And I think we have an energy in Birmingham to be bolder, to be braver, to be brilliant in what we do. And there are so many amazing things across this city, so many jewels. And the irony is, in the city of 1,000 trades, we're not very good at wiring the jewels together to make them into necklaces. My hope, my ambition is that by the time I move on from this role, which is not something I'm planning to do in the immediate future, but that by the time I leave Birmingham, we will have many, many more necklaces around the city and many more people who are enjoying their potential in life because they live in a city, they live in communities, they live in an environment in which makes it easier and more affordable and more sensible and simply more pleasurable to be healthier and happier.